purpose of this study was to investigate if older long-term cancer survivors are at an increased risk of an opioid-related ED visit or hospitalization, because cancer survivors tend to have a higher prevalence of chronic pain than those in the non-cancer population. And also, they receive or could receive more opioids as a result of this chronic pain. Hello, my name is Derek Gibson. I'm a 7th year MD PhD student at the University of Texas Medical Branch at Galveston. Today, I want to talk to you about one of our papers entitled Risk of an Opioid-Related Emergency Department Visit or Hospitalization among Older Breast, Colorectal, Lung, and Prostate Cancer Survivors. This manuscript will be appearing in the March 2022 edition of Mayo Clinic Proceedings. In this study, we performed a 1-to-1 matched retrospective cohort study in which we matched long-term breast, prostate, colorectal, and lung cancer survivors to persons without a history of cancer diagnosis, and assessed if cancer survivors are at an increased risk of opioid-related ED visit or hospitalization compared to persons without a history of a cancer diagnosis. For our analysis, we did both an unadjusted and an adjusted analysis. We matched 90,515 long-term cancer survivors 1-to-1 to 90,515 persons without cancer who had never previously used prescription opioids in the year before follow-up. We also matched 5,862 opioid non-naive long-term cancer survivors with non-cancer controls. We followed these individuals on average for about 3 years, but the maximum time that we could follow a person would have been 10 years. When we conceived of this study, we thought that cancer survivors would have a higher risk of an opioid-related emergency department visit or hospitalization because of prescription opioids due to their higher prevalence of chronic pain. We thought that what we would see would be an increase in this risk. In our unadjusted analysis, we found that long-term cancer survivors who did not use prescription opioids in the year before follow-up were significantly less likely to experience an opioid-related emergency department visit or hospitalization. However, when we adjusted for patient characteristics and clinical characteristics, such as pain conditions, the number of comorbidities, we found that there was no significant difference between individuals who had a diagnosis of cancer to those individuals who had not had a diagnosis of cancer. What our study means for patients is that prescription opioids can be harmful. This is regardless if they have been diagnosed with cancer before, and regardless if they have chronic pain or not. Prescription opioids can lead to many unintended consequences. These include cardiovascular, respiratory, even our endocrine system can be affected. But most importantly, these can lead to acute events that require an emergency department visit or even to be hospitalized. Our results are meaningful to practitioners who prescribe opioids, who may be more willing to prescribe opioids to long-term cancer survivors because of this thought of higher prevalence of chronic pain. Therefore, we caution individuals to find alternative pain management regimens. These include things like acupuncture with electrostimulation, exercise, physical therapy, occupational therapy, things non-pharmacological pain management techniques that can improve individuals' well-being. and avoid the risk of an opioid-related emergency department visit or hospitalization. When prescription opioids are prescribed, we recommend close monitoring of these patients. We must keep in mind their safety, their health, and their well-being. We must focus on the potential consequences of opioid prescribing. We should see how well they're breathing, how good their heart is, and making sure that they're not suffering any unanticipated GI side effects from the medication. Most importantly, we should avoid prescribing opioids for long durations and avoid prescribing at high dosages. In conclusion, our study builds upon previous survivorship literature by demonstrating that long-term cancer survivors are as likely as persons without cancer to experience an opioid-related emergency department visit or hospitalization. Care is needed when prescribing opioids to older adults because prescription opioids can lead to adverse events, even if they are taken as directed. Policies and clinical guidelines that promote and incentivize increased adoption of evidence-informed, non-opioid, and non-drug approaches by clinicians for pain management in older adults with or without a history of cancer have potential to lessen high-risk opioid use and its attendant opioid-related morbidity and mortality. We invite you to read our article in the March 2022 Mayo Clinic Proceedings. If you have any questions, please feel free to reach me at my Twitter handle at Derek C. Gibson. Thank you.
We hope you found this presentation from the content of our website valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you'll find access to information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.